Unusually, we are having a second freedom of the city now, and again, thoroughly well deserved. A group, they're part of the wider group that has probably done more to enhance the reputation of this city than any other group in the last 4 or 5 years, as you all know. So what I would like to do is please to invite, Councillor Upton, please, to come and propose the conferment of the freedom of the city on the NIHR Oxford Biomedical Research Centre. Louise.
Thank you, Lord Mayor. A huge welcome to everybody who's come here today to be with us as we're proposing to bestow the freedom of the City of Oxford on the NIHR Oxford Biomedical Research Centre. Now, we are quite often when we're giving the freedom of the city, it's for improving lives. It's not often that we get to give it for actually saving lives. And in this case, we're not just talking about a few lives. The Oxford Biomedical Research Centre was established in 2007. It's a partnership between the Oxford University Hospitals NHS Foundation Trust and the University of Oxford. So this means it brings together academics and clinicians in a way that means that they can translate, say, scientific breakthroughs into potential new treatments in a way that neither could do on their own. So, as James has alluded to, the Biomedical Research Centre is really, of course, known around the world for its key role in the development of the Oxford-AstraZeneca Covid-19 vaccine. And crucially also, actually, for identifying potential treatments for severe COVID-19. So, but between these two achievements, their work has probably saved, at last count I read, more than 6 million lives. 6 million lives saved by these people. So I don't know about you, but I always feel a little swell of pride every time I hear about the Oxford-AstraZeneca vaccine mentioned in the press. And because I think this was something really, really special. It was, it's really the best of humanity. It combined the work and the brains of the BRC with the clinical power and excellence of the NHS, with the volunteers amongst our citizens who put themselves forward to be guinea pigs. And let's not forget that there was the commercial company AstraZeneca who put aside their profit margin and got 26 vaccine production centres up and running around the world to get this vaccine out at the most incredible speed and at cost. So, for that, they are known across the world. But I think we should also remember that although it was the COVID pandemic that sort of thrust them into the limelight, the Biomedical Research Centre has also produced transformative treatments for all sorts of other things as well. They're things for stroke, cardiovascular disease, cancer, lots of different infectious diseases. I think they're now doing work on gene therapy and the use of artificial intelligence for diagnostics. So their work has already had a huge beneficial impact, not just on the people of Oxford and Oxfordshire, but nationally and even worldwide. But it is going to be doing so for decades to come. We have just given the freedom of the city to somebody who was born and bred in Oxford. But today, with this one, we're actually giving it, I think, to people who come from all over the world to work in Oxford. So I'm a scientist at the university in a different discipline, but I know if you take any lab of 20 people, you'll probably find at least 15 different nationalities within it. So we're talking, there's probably people from all of the 5 inhabited continents of the world working in the BRC. So this award is for all of those. It's also for the many ordinary citizens of Oxford who got involved in clinical trials, who volunteered to trek up to the JR every few weeks to give a blood sample, to do some tests, sometimes over several years, and often with no benefit to themselves. And we do have 1 or 2 in the audience today, but they're doing it because they know it's helping push back the boundaries of knowledge and improve the treatment of care of everyone. So, this award is about the genius of some extraordinary people whose brains are behind some incredible scientific advances. But it's also about the people who wash the test tubes, although to be fair, there aren't many test tubes involved in science anymore. But television always likes to show pictures of people, someone pipetting colourless solutions around. But someone had to sterilise those pipette tips, somebody had to order them, someone had to wipe the bench down afterwards, someone had to hold out their arm to give the blood sample, and someone had to write the grant application. It's a team effort. Science is a team effort. And today we are recognising that whole team. So this is a massive thank you to you from everyone in Oxford whose lives you have saved or improved or whose loved ones you have helped. Although awarding the Freedom of the City is the highest honour that Oxford City Council can bestow, I think the rest of the planet will probably also join us for a round of applause for you. So, on that note, I hereby propose the NIHR Oxford Biomedical Research Centre for the Freedom of the City of Oxford. Thank you.
I would now like to invite Councillor Chris Smoten to come and second the conferment.
Thank you, Lord Mayor. I'll see if I can get through the list in one breath. Deputy Lieutenant, Lord Mayor, City Sheriff, Honourable Recorder, Under Sheriff of the County, Member of Parliament, distinguished guests, and everybody else present. Although do put a hand up if you feel you're particularly undistinguished. I'm actually not sure what distinguishes those last two. So I've had the good fortune to work on both sides of the fence between sort of academia and in industry, and it's remarkable the way that on one side we see sort of dozens of incredible ideas that aren't yet able to do people as much good as they could because they require sitting down and working out all the tangly practicalities. And then on the other side, we find in industry solutions that can be improved if we can bring the very latest research to bear and to be useful in practice. That's why it's so important to have dedicated people bridging that gap and turning the possible into a reality. And why it gives me great pride to share a city with the teams that are realizing incredible advances on our doorsteps. Even setting COVID aside, so many of the strands of work being undertaken could make revolutionary differences, from detecting the onset of cancer to hacking faulty genes in situ to prevent degenerative diseases, to understanding the onset and the course of diabetes, to arresting the progress of Parkinson's disease. There are dozens of projects that are happening right now, not 10 miles away, that will alleviate suffering and save, as we've heard, millions of lives. Although I note when I wrote that, I wrote right now, and it's now 7-ish, so probably in the pub. But at some point, right now was accurate, and it probably will be again tomorrow. For all of these reasons, it gives me great pleasure to second and support that the honorary Freedom of the City should be conferred upon the Oxford Biomedical Research Centre.
I will now put it, as with Francis, to the vote of councillors alone. Please, those in favour of the conferment indicate. Those against? Abstentions? Unanimous? Congratulations. I invite Helen McShane to come up on behalf of the BCR, as I will call it. And no one has actually asked what the freedom of the city entitles you to. And actually, between you and me, I hope you don't ask us. But it is a great honour. So let me present you with this lovely certificate. Here we are. Well done. Congratulations.
Deputy Lieutenant, Lord Mayor, City Sheriff, Honourable Recorder, Under Sheriff of the County, Member of Parliament, distinguished guests, ladies and gentlemen. It is with great pleasure and pride that I accept this honour on behalf of the NIHR Oxford Biomedical Research Centre. I would like to thank Councillor Upton and Councillor Smerton for proposing and seconding this motion and for their kind words about our BRC. As an organisation rooted in two of the city's great institutions, we are a partnership, as Councillor Upton explained, between Oxford University Hospitals, NHS Foundation Trust, and the University of Oxford. It gives us enormous pleasure and pride to be recognised by the city we call our home, and of whose thriving clinical academic ecosystem we are an integral part. While this honour is usually bestowed on individuals, such as Baroness O'Grady, it is perhaps fitting that our award recognises the contribution of thousands of Oxford-based researchers, clinicians, and members of the public who undertake and support our research. It is an ongoing privilege to work with them all. I should perhaps explain here what the Oxford BRC is. We are part of the National Institute for Health and Care Research, or NIHR, a government body that is the biggest funder of healthcare research in the UK. A BRC brings together academics and clinicians to translate scientific breakthroughs into potential new treatments, diagnostics, and medical technologies that benefit not only NHS patients, but also those in social care. Our BRC was one of the first to be established in 2007, and we have just received our fourth round of 5-year funding from the NIHR to carry out research across 15 different research themes. Our BRC, as a key funder of Oxford University scientists, came to national and global prominence, as has been said, during the COVID pandemic. We played an important role in the development of the Oxford-AstraZeneca vaccine, but also in the recovery trial, which identified a number of effective treatments for severe COVID-19, thus saving millions of lives. Our microbiology teams also played a crucial role in developing antibody tests and identifying new variants, but also in informing government policy by mapping the immune response to the virus in the wider population. But our research extends far beyond the COVID pandemic. Oxford BRC researchers have transformed the way we treat everything from stroke to hip fractures, from cardiovascular disease to diabetes. We have developed new vaccines for malaria and typhoid. We are testing new ways to diagnose cancer earlier. We're using gene therapy to tackle blindness. We're leading the way on how to use genome sequencing, patient data, and artificial intelligence. This is not just scientific achievement for the sake of it. Our research is intended to benefit the NHS, its clinicians, and most of all, its patients. Our BRC is hosted by Oxford University Hospitals. Our researchers are embedded in the John Radcliffe, Churchill, and Horton General Hospitals and the Nuffield Orthopaedic Centre, and it is hugely beneficial to our work that OUH is an environment that is so supportive of research and innovation. Our research aims to address the needs of the modern NHS. For example, an important new research area for us is taking digital innovations we have successfully introduced into hospitals and testing them in community settings to deliver care closer to patients' homes. This will not only ensure continuity of care, but also reduce unnecessary hospital admissions and deliver better outcomes for patients. Similarly, we're increasingly looking to use tools such as apps or wearables that allow patients to monitor their own conditions, allowing NHS staff to better deploy their resources more effectively. Another area where we're having a huge positive impact on the Trust is our support for nurses, midwives, and allied healthcare professionals to carry out research. Traditionally, it's been medical doctors who've led high-profile research programs which have delivered countless medical breakthroughs. But there is an increasing recognition that all of our clinical colleagues can play a vital role in improving patient care and treatment, not least those who are interacting on a daily basis, who are well placed to identify the incremental improvements that make a difference to patients' quality of life and outcomes, and complement those more headline-catching results. For this reason, we funded key nursing research leadership positions and created a clinical academic pathway for nurses, midwives, occupational therapists, physiotherapists, and all other allied healthcare professionals. Thanks to this support and the dynamic research ecosystem here, patients in Oxford have access to the very latest technology and expertise. It's little wonder that the people of Oxford and the wider area have shown themselves to be enthusiastic participants in our clinical trials. More than 17,000 people took part in trials at OUH last year, helping us to push forward the boundaries of diagnostics, treatment, and care. Even more heartening are those patients and members of the public who want to get more deeply involved and help shape our research, make sure that we are researching the right things, checking how our studies are carried out and the results are shared. In short, making sure that our research really responds to the needs of the populations we serve. I'm very pleased that with Oxford Health BRC, we have created a vibrant diversity and research group which advises us on how we can include communities that rarely engage in research. The success of the BRC is founded not just on the very best in academic healthcare research and NHS clinical excellence, it also benefits from the wider clinical academic ecosystem in this city, from the thriving life sciences sector, and from the support of the people of Oxford. Our success is inseparable from the fertile environment in which we are located. This honour that you bestow on us tonight belongs to the whole city. Thank you.